chains, and this forms the hemoglobin. And this is important for carrying the oxygen to different parts of the body. To each and every cell requires oxygen for its survival. So this is very, very important for us. And apart from this, it is also a part of myoglobin, which is useful for the muscle contractions. And it also plays a major role in immunological conditions. So this is the importance of an iron. Then this anemia, when we call it as an anemia. Next slide, please. According to the WHO criteria, hemoglobin levels are less than 12, it is considered as anemia. And in pregnancy, less than 11 is considered as anemia. And in postpartum stage, less than 10.5 is considered as anemia. And we grade it as mild, moderate, and severe based on hemoglobin levels. So mild is when the hemoglobin levels are around 8, and when there is between 5 to 8, it is called moderate, and when less than 5, it is severe anemia. Next one. And there are various causes for anemia, and we have to, whenever you're saying that it is nutritional anemia, you have to rule out different causes that are for anemia, because we cannot treat the genetic causes of anemia by giving diet and dumping over iron in their bodies. So we have to definitely know what is the exact diagnosis before starting the treatment, and that is very important. There are various causes for anemia. First thing is we have to look for genetic causes like thalassemia, sickle cell anemia, or any other hemoglobin chain disorders. We have to look for that. And then we have to consider other things. When we rule out those causes, we can consider this as nutritional anemia. And the most common causes for nutritional anemia is either iron deficiency, folic acid deficiency, or vitamin B12 deficiency. These are the most common causes of nutritional anemia. After ruling out other causes, we have to consider these. Next slide. So what happens is pregnancy is a demanding physiological state, because you have dilutional anemia also, because there is a increase in the plasma levels, and the increase in RBC will not come to increase in plasma levels in pregnancy. So definitely you will have dilutional anemia, what we call, because of the dilutional state, we call it as a dilutional anemia. And what happens in India is it is observed that diets for women from low socioeconomic groups are essentially similar, because they don't concentrate or focus on the diet in India. Let me tell you an example. We have been organizing several camps in several schools in most of the places, surrounding areas. Basically, I work in a peripheral area. So most of them belong to low socioeconomic status. So when we conducted camps in different schools, what we have observed is the highest level of hemoglobin in what we have observed in most of the schools is around 7 grams. Unfortunately, they don't know what is the importance of this low hemoglobin levels, and what can be done to reduce this hemoglobin levels. So definitely we have to consider this.
Uh, Dr. Madhavi, can you hear me? You are on unmute. Could you please unmute? Yeah,
Yeah.
so the voice went in between. So could you please just re-explain pregnancy and malnutrition this slide? Yeah,
Yeah.
the video was stuck in between. Yeah, thank you.
Okay. 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 Pregnancy is actually a demanding physiological state. What happens is, in pregnancy, the levels of plasma increases in comparison with the RBC count. So definitely there are low hemoglobin levels in pregnancy. And what happens is in India, the pre-pregnancy diets are almost similar to the diets in pregnancy. They don't much concentrate on diet. That is the problem happening here. And we have been organizing lots of camps in lots of schools in the surrounding areas. Basically, I work in a peripheral area. So when we see the hemoglobin levels of all the girls, most of the girls, it's only around 7. Unfortunately, they don't know what the importance of having this good hemoglobin levels and what happens to the body and what happens in the future. Basically, they don't concentrate. So educating them is very important. Pre-pregnancy levels, they should have good iron stores so that they can compensate for the iron losses in their body. What happens next in the during menstruation and pregnancy. So educating them is very, very important here. So what happens is in the pregnancy as well as in the pre-pregnancy state, they will be taking the same diet. Consequently, there is wide prevalence of maternal malnutrition in these in mostly in our country. Next slide, please. So, what is a basic reason for this anemia is iron deficiency. It actually has 80%. 80% is the reason for this iron deficiency is the reason for anemia. So, of the iron stores in the body, 1 milligram of iron is lost every day due to death of the epithelial cells. Basically, iron is stored, is usually circulating in the form of hemoglobin, and then it is stored in either liver, bone marrow, it is our spleen. What happens is, so we determine the iron stores by doing the ferritin test, the levels of ferritin which is available in the body. Of the iron stores which we have in the body, 1 milligram of iron is lost every day due to death of the epithelial cells. So what happens is so the average Indian mixed diet contains 12 to 15 milligrams of iron, of which only 10% is absorbed daily. Next slide, please. So, what can be the reason of our iron deficiency? There can be various reasons for this iron deficiency because of the increased demand, inadequate supply, and increased blood loss. So you have to rule out before treating them by giving them diet or prescribing them some diet plan. You have to rule out the basic underlying cause why they're having this iron deficiency. So one thing is increased demand, inadequate supply, and increased blood loss. So you have to rule out the basic underlying cause why they're having this iron deficiency. So one thing is increased blood loss. So when you are in your puberty and some other changes happening in your body like pregnancy or all these changes, they have increased the demand for hemoglobin where you're not supplying. So increased demand is one reason, and inadequate supply. So you're not giving the adequate supply. You're not taking adequate levels of iron. And the other thing is when you're taking your diet. Next slide, please. Yeah, inadequate supply results when diet is either deficient in iron or doesn't provide iron in an absorbable form. So, what is this absorbable form? Because whenever you're taking your iron supplements or iron, you have to take it in an absorbable form because otherwise, when what happens is when you're taking iron supplements or iron rich diet along with a carbohydrate rich diet, um, it combines with phosphates and phytic acid to form insoluble complexes that are not absorbed. So in this way, you're not meeting the daily requirements. So it's not getting absorbed and it's getting excreted from the body. And the other thing is hypochlorhydria. which is low levels of HCl, which is basically required for the acidity of the stomach and basically required for the maintaining all the enzyme levels in your body. What is seen in malnutrition, loss of appetite, and vomiting can also cause iron deficiency. So I think I'm clear. First thing is first thing is increased demand, like any condition that changes your body metabolism or puberty or growth spurt or pregnancy, there is an increased demand for iron supplies and you're not supplying it properly. That is the increased demand and the inadequate supply. This is the reason for inadequate supply. And the other reason also inadequate supply when you too much rely on junk food like processed foods. All these processed foods are devoid of iron. So that also can be inadequate, one of the reasons for inadequate supply. And the next one is increased loss from the body. Next slide, please. So increased loss can be happening in some certain conditions like hookworm infestations or occult blood loss. Like if you're having any gastrointestinal conditions where you're losing your iron, occult blood means you can't see the blood out in the stools, but when you under microscopic examination, you can find the blood in this stool. And there can be various reasons for this, and also excessive bleeding during menstruation. These all can be the reasons for excessive loss of iron supplement iron. So these are the reasons. You have to rule out each and every cause before treating the patient. And the other reason can be repeated pregnancies, recurring at short intervals. Multiple pregnancy and teenage pregnancies can result in severe iron deficiency. And pregnancy causes the iron stores of body to be exhausted, and adequate time is required for this stores to be replenished. What happens is in most of the patients which we see, what happens is they come again within 1 year of pregnancy. Within 1 year, again they come with the second pregnancy. So we are not giving our body to replenish all the stores which have been consumed in the previous pregnancy. So what happens is you're entering your pregnancy with in a iron deficiency state. So there is no time to replenish. Definitely, then what will happen is your iron stores are less, your supplementation will be less, the absorption may be less. So you will be in an anemic state in your pregnancy. So, if pregnancy recurs within a short period, it occurs in a state of poor or no iron reserve, leading to iron deficiency anemia. So, that is why it's recommended that at least 2 years of interval is recommended between pregnancy to outcome to come out of all these complications. What happens because of iron deficiency anemia and pregnancy? Okay, next slide, please. So, how are you going to diagnosing anemia? So, whenever you're treating a particular patient, so first rule out all the causes and rule out all the causes like genetic causes. What can be the reason? Whether it is a nutritional deficiency anemia or genetic. So, genetic history is also important because sometimes what we do is definitely we'll not investigate the patient. We generally treat them as nutrition anemia as most of the cases, unless until we have a suspicion that there can be something wrong because your iron even after iron supplements hemoglobin levels are not going up, and all these things we have to consider other genetic causes. So family history is also very important because the sickle cell anemia and thalassemia, these are all hereditary conditions, so we have to rule out that. And we also have to rule out like where the patient history is also very important, whether she's having excessive bleeding during her periods, like how long is she bleeding, whether she's having any hookworm infestations, whether she's bleeding through her rectal bleeding is there, or whether how is she taking her iron supplements or iron, because see, when we are taking with iron supplements or iron rich food along with lot of caffeine and all these things, the iron absorption ultimately will decrease. So whatever you're taking, even though you're taking your iron-rich foods, adequate supply is being given to the body, there will be no absorption of the body. So patient history-wise is also very important. You have to rule out everything before you come to a conclusion, and then you will be diagnosing through lab features also, like what is the blood picture like, how is it looking. So all these things we'll exclude, and definitely once you confirm it is definitely only because of the iron deficiency anemia or deficiency of folic acid and B12, because in B12 and folic acid deficiency what happens is the cells look larger. So we call them as megaloblastic anemia. So you have to definitely look at the blood picture also. So, but most of the patients you will be treating, they come to us only like nutritional wise when you're confirmed only. So, but you have to have a basic idea like how can we diagnose anemia. So once you are diagnosing anemia, the conditions like what are the symptoms and signs you can see in anemia is also important. So for mild anemia, you may not notice anything apart from the pallor that we can identify. But when there is a moderate anemia, it may show symptoms of fatigue, weakness, and a feeling of exhaustion. So basically, what's the problem? Why are you having exhaustion or fatigue or weaknesses? Because nothing iron is a part of hemoglobin, and hemoglobin is being circulated throughout our body through RBC, and it is supplying oxygen to various cells for its metabolism and for its activity. So when this same amount of hemoglobin has to be pumped, if it's less or high, the same amount of hemoglobin has to be pumped for all the cells in the body to work. So what happens is there is ultimately a lot of pressure on the heart, pumping the same thing around again and again. So that results in fatigue and weakness and a feeling of exhaustion. You'll be having some breathlessness also. And some non-specific symptoms like pica might be present. This is what is it? They have they have some they'll take some foods which are abnormal, like who don't regularly, they will be eating some chalk or the raw rice and all these things that will also decrease the absorption of iron. So I'll tell you an example here as well, because we have a patient when she was first few antenatal visits, her hemoglobin levels are almost 9.8 and 10, and after that, when after 2 to 3 visits, her hemoglobin levels are 6. So here we have to take into consideration two things: either compliance, whether she's compliant to her medicines or not, whether she's regularly taking her medicines, and whether she's taking adequate iron supplements which have been prescribed in pregnancy. So when we ask the patient, she's saying, yes, both of them. I'm very regular. I'm taking my medicines, and she showed all the things that I'm regular with my medications I'm taking. And she also told about all the food what she's taking. So everything, nothing to doubt about that. Then we can ask. Then I asked her like, what else are you taking? Are you taking any chalk or raw rice? They will be eating that rice. So that rice, yeah, she's been eating lots and lots of raw rice. Because of that, what happens is it is the tannins and the phosphate phytic acid content, it decreases the absorption of iron, and ultimately it will result in anemia. So this point also you have to take it into consideration when you're if the patient is compliant and she's taking her diet properly, what can be the reason? You can have to rule out all these things also. And then severe anemia. Severe anemia shows symptoms of cardiac failure and breathlessness. Next slide, please. So what are the signs? You have see when you're seeing the signs of anemia, that pallor and glossitis, koilonychia, that is a spoon-shaped nails, and pedal edema. When the pedal edema, because of there is a cardiac failure, anemia resulting in cardiac failure, ultimately you will have see a lot of swelling, a puffiness of the face you can see, and swelling and of the legs, and pedal edema you can see, and the other thing is jaundice. Next slide, please. And what are the effects of anemia in pregnancy? Here I can see that they wanted me to explain some terms. Can they just ask what terms they wanted me to explain? From Sujata Lakshman, can you tell me like what terms can I explain to you? Glossitis, yeah. When you look at her tongue, you can see that the tongue is almost like, you can see it's very red in color, like something in infection on the tongue, that is called the glossitis. And koilonychia is a spoon shaped nails, and pedal edema is the swelling of the feet, and jaundice is yellowish discoloration of the urine or your body or your eyes, that is jaundice. Next one, next slide please. Then effects of anemia in pregnancy. So why are we concerned about anemia in pregnancy? Because when your iron supplement, when your hemoglobin levels are low, what happens is the baby can be affected in different ways. The one thing is there is IUGR, which we call as intrauterine growth retardation, where the baby's growth is on the lower side when compared to the normal pregnancy. So that is called intrauterine growth retardation. And preterm labor. Preterm labor is one thing where the delivery happens before 37 weeks of pregnancy is called a preterm labor. So preterm labor, because of this preterm labor, it can have lot of effects on the baby because they not be baby's lung maturity may not happen, baby's brain will not be mature enough, so they have a lot of morbidity on the babies. This is preterm labor. And excessive bleeding after delivery leading to maternal death and morbidity. What happens, we call this as a postpartum hemorrhage, one of the dreadful complication of deliveries, because when there is excessive bleeding after what happens is, because of low iron levels, the muscles in the uterus may not contract normally during their delivery, after delivery, which happens normally. So if it doesn't happen, the patient will bleed, and ultimately the patient will collapse. And sometimes it may lead to death or else any other complications further. Yes, next slide, please. But what happens is, unfortunately, most women start their pregnancy without adequate stores of iron to meet their body's increased demands, particularly in the second and third trimesters. Next slide, please. Okay. So coming to the important thing of dietary management. So what are the do's and don'ts, and what are you going to advise to the patients in view of, it's from the dietary view. Okay. So am I clear till now, or anything you wanted to ask me? Anyone? Yes, Namita. Okay, I will be a little bit slow. Yeah. So coming to dietary management. Yeah, you want from Pramila, sir. Yeah, what do you want again? Any particular thing? Anemia. Okay, then anemia is like when your hemoglobin levels are lower, we call it anemia. And when the hemoglobin level is less than 12, it called it as anemia, and less than 11 in pregnancy is called as anemia. And uh, when the hemoglobin levels, it is again, we have a classification from WHO. It is mild, moderate, and severe. When it is less than 5, it is severe, and between 5 to 8 it's moderate, and 8 and above is mild. So this is called anemia. And there can be various reasons for anemia, like it can be because of hereditary conditions or genetic conditions. And like you have to rule out what are the why is this patient pale, what happened, or what can be the reason. But what we see is mostly the dietary reason will be one of the cause for this anemia. Most of the cases it is nutritional anemia. In nutritional anemia, it is either due to iron deficiency, folic acid deficiency, or B12 deficiency. So we have to exclude that what kind of anemia the patient is having. And in yeah iron from iron from animal source also. Yeah, first coming to the dietary management, we can dietary management, we can have two types of dietary sources, either from the vegetarian sources or non-vegetarian sources. But vegetarian sources, also have rich supply of iron as well as non-veg, but the non-vegetarian sources like animal sources of iron have much more better absorption and much more faster increase in iron levels when compared to plant sources. So the other things which we can take into consideration when you're suggesting a patient regarding iron absorption is taking vitamin C rich foods along with iron will increase absorption of iron, and good vitamin C choices include a glass of orange or tomato juice. So whenever you're prescribing iron supplements to patients, you can ask them to take vitamin C rich foods half an hour before taking the supplement, or you can ask them to take a glass of orange juice or tomato juice before taking your iron rich foods or iron supplements. And the other source of vitamin C is handful of strawberries, bell peppers, or half a grapefruit. And it is important to note that body absorbs iron from animal sources much more readily than from the non-animal sources. So these are the first initial things which you are saying, telling your patient before giving any iron supplements or iron-rich foods, because you have to tell iron absorption increases with vitamin C. Is it clear? Next slide, please. And what are the do nots? What precautions you have to take when you're telling them to take either iron before taking iron supplements or iron rich food? Is you have to ask them to avoid caffeinated beverages along with high iron foods, because it will reduce the absorption of iron in the body. And when you're, because in pregnancy, we usually prescribe iron supplements and calcium supplements. We advise the patients to take lots of milk to increase the iron supplements in the body. But calcium interferes with ability of the body to absorb iron. So whenever you are telling them to take either milk or caffeinated beverages, you have to ask them to give time before you take your iron-rich food or iron supplements. So calcium supplements must be taken only after some time after taking your iron supplements. And calcium supplements or an antacid that contains calcium taken while eating the iron rich foods or at the same time as an iron supplement can hamper its absorption. And milk also, which we usually suggest in pregnant patients to take 2 times milk and all, you have to give them, advise them, like calcium can interfere with absorption of iron. So you have to give a certain time before taking your iron supplements, before after taking calcium supplements. And one more thing is when you're asking them to cook, you can suggest them to cook in iron vessels, because cooking in iron vessels also increases the rate of iron absorption. And one more thing is fiber rich foods. What happens is when we are giving fiber rich foods along with iron supplements or iron rich food, iron in this gets absorbed in the fiber, and then it doesn't get absorbed in the body, and it gets excreted through that fiber. So you have to suggest also to take lots of water. And when you're taking fiber rich food, you can take your supplements of iron supplements later stage rather than along with food, because all this will decrease the absorption of iron. Is it clear? Yes, next slide, please. So yeah, because iron absorption will take, because ideal time gap between caffeine is mostly 1 to 2 hours. You can give gap, and then you can take your iron supplements. And when you take an vitamin C content food, rich content food, you can take after a half an hour, because it increases the absorption of iron. You can just take half an hour gap and then take your iron supplements when you're taking iron rich food. Sorry, vitamin C. And caffeinated beverages, at least give 1 to 2 hours time before you take something rich in iron or iron supplements. Always it is a better advice to treat patients with anemia with on a dietary basis, because when you're taking high levels of iron supplements, what happens is most of the patients will complain, have this upset of the gastrointestinal tract. And whenever iron supplements are being given to the patient, they either complain of constipation, or they will be having some irritation, like they'll be having this vomiting sensation. And very rarely few patients will have diarrhea. Because of all these reasons, patients are not compliant. They will not be taking these iron supplements regularly. So compliance is also very important to increase their levels. So in pregnancy, when are you going to give iron supplements, and when are you going to give dietary advice, and going to um, when are you going to give injectables? So that is also important. I can, yeah. It may be because almost the patient has come in 8 month of pregnancy, and you can't give her only nutrient advice, dietary advice. Definitely, iron supplements have to be prescribed, but it's almost 34 weeks because iron absorption takes some time, and so it may take some time, and the iron stores may not build up. So that time what you will do is you have to give them some injectables, which increases where there can be a rapid increase in the HP levels. But when you're seeing the patient in the first trimester, like initial stages of your pregnancy, it is definitely a better to start them with some nutritional advices, like what to take and how to take, and what are the rich sources of iron. Can anyone tell me like what are the richest sources of iron? Yeah, beetroot is rich in iron, but it's rich in yeah, beta carotene levels. Yeah, the highest levels is present in drumstick leaves, and dark green leafy vegetables, like all the green leafy vegetables, spinach. Yes, spinach to everyone. Dates is also rich, and broccoli is also rich in iron. So mostly all the green leafy vegetables, it's very rich in iron. And you can also like cress seeds, watercress seeds, they are very rich in iron. Yeah, liver, yeah, liver is also rich in iron, and the absorption is also rich. But what happens when you're taking lots of livers in pregnancy, because it is an animal source, and the levels of vitamin A also will be higher in liver when you take a lot of liver supplements, liver in your diet. What happens is that can cause some level of toxicity. So we usually don't advise animal liver to be taken in pregnancy. Yeah, tofu and paneer, and these are all rich sources in calcium rather than iron. So jaggery, you can tell, watercress seeds or richest source, drumstick leaves you can have, and the other one is, yeah, watercress seeds is a type of seeds which comes in packs available, and they have the highest amount of iron. Yeah, chickpeas, like it's rich in protein, but also they have certain content of iron is present in most of them. But dark green leafy vegetables are the richest. Sesame seeds was also a very rich source of iron content. But what happens is when you take sesame seeds, these sesame seeds acts as initiates the uterine contractions. So it's not advisable, because so we don't prefer giving sesame seeds in pregnancy, because they have a certain effect on uterus. Because when if you see certain girls with irregular periods and all, what happens? We usually ask them to take sesame seeds, because this sesame seeds has a capacity to initiate uterine contractions. So they can cause regular cycles. But so it's usually sesame seeds are not recommended in pregnancy. Yeah, what is this, Rupa? And then next slide, please. So good pre-pregnancy nutrition is very important. So basically educating the girls is very important, because girls around usually most of the peripheral places or rural places, what you see is they get married at 17, 18. Good seeds are good source of iron. Yeah, this is watercress seeds. They're all very rich in iron content. They're usually available in packs. They're available and you can take them. You can just soak them and take them, or you can make a powder and mix with any of the things and you can take them. And basically all the girls in rural areas get married by around 16, 17, 18 years, and their iron levels are very less. So important thing is pre-pregnancy pre-pregnancy nutrition Awareness is very important in these girls. Yeah, how to avoid constipation is what you can ask them is, when you're taking iron supplements, definitely most of them complain of dark stools or constipation. How to Dark stools are not avoidable because of the iron content. Usually they'll have dark stools, but you have to tell the patient that they have dark stools when you're giving iron supplements. And how you can prevent constipation is, you can ask them to take plenty of fiber rich foods, and you can ask them to take lots of water. And sometimes you have supplements which have a laxative also with them. If you have a lot of constipation problem with this iron supplements, you can ask them to take that. Some medicines will be available which have a laxative effect also, the combination drugs. So you can take even them also to prevent constipation, and take lots of water. Quantity of water proceeds depends on the levels of anemia is there, because each some it may be suitable for some patients and may not be suitable. So you can take into consideration the dietary habits of patients, and how whether it is suitable for them or not. Yeah, coconut oil is also a natural laxative. You can take even that, but usually they don't prefer. Most of the people may not prefer that. So apart from that, you can try this dietary sources like fiber-rich food, water. Taking lots of water content may help with the constipation. Or sometimes, if there is a chance, like if the patient is not very anemic, what you can do is you can take it like alternate days. One day you can give a gap, and other day you can take. In that way, also you can help the patient. And severe constipation, and if they're having severe problems with iron supplements, um, what you can do is, uh, yeah, you can take organ meat. Meat is good because animal sources of animal sources of all these animal sources are very rich in iron, and absorption is also better and faster when compared to the plant sources. So you can take that also. Yeah, when the supplements, when you're taking iron supplements and it's very troublesome for you, you can go for injectables also, because in the injections also you can have a faster increase in iron levels. Yeah, why fruit like pineapple is asked to be avoided in pregnancy is, there is an old, because all the older people, what they say, usually pineapple is good in pregnancy. There is nothing like you should avoid pineapple in pregnancy. But what all elderly people or the older generation people will say is, when you give too much of pineapple in pregnancy, the baby's stools will be in that color, and something which we call like so that is not good, they say, but nothing to do with pregnancy. It can be given in pregnancy, so that's not a problem at all. If your patient wants to take pineapple, she can take. But usually what happens is, when patient comes and asks us like whether I can take a pineapple or something, yeah, you can take. That's what we usually answer. But what happens is, because they're eating that fruit with a suspicion, because someone in the house told them not to eat, but still you prefer to take it. So if something happens, no, they will blame everything only relating to that pineapple. Yeah, papaya also can be taken. Papaya has nothing to do with pregnancy. It can be taken. Raw papaya, what happens is, this raw papaya have the capacity to initiate uterine contractions. So most of the people, some people, what they'll do, when they don't get their period, or when they're suspecting a pregnancy, instead of going to a doctor, most of them will take raw papaya to have a period, to induce menstruation. They take that because raw papaya has an action on the uterine muscle layers. So that is also, otherwise raw papaya is only avoided. Otherwise, normal papaya they can take in pregnancy. And now, how to prevention of anemia is iron rich foods. Iron rich foods, good pre-pregnancy nutrition not only helps prevent anemia, but also help build other nutritional stores. So whenever you see a patient with high levels, very low levels of hemoglobin, generally what you will do is, you will either prescribe some iron supplements or prescribe some iron, but you have to also give them some folic acid rich diet, or folic acid also along with the iron supplements, because for a blood cell to be constructed, or whatever it is, whatever the hemoglobin part, you should have folic acid also along with the iron. So when you're giving this iron rich foods or iron supplements, prescribe them folic acid also to have a better hemoglobin levels. So what good sources or iron? What are the good sources of iron? Or meat, poultry, fishes, leafy greens, and legumes. These are all the very rich sources of iron-rich foods. Next slide, please. So other types of, that's what we have been discussing. Other types of anemia, what we have to rule out, because we have to rule out other causes, and whether the anemia is only because of iron deficiency or folic acid and B12 deficiency also we have to take into consideration, because the treatment of anemia depends on the cause. Next slide, please. And folic acid in also plays a very major role in neural tube defects. So usually we give 400 micrograms of folic acid. Pre-pregnancy also they can be supplemented. And if a patient is having a history of neural tube defects, like neural tube defects in the sense has spine problems in the baby previous pregnancy, if the baby is having a spine problem or the baby's head has not developed properly, which we call as anencephaly, where the upper part of the skull doesn't develop, and where there is any problems in the back, spinal problems. These are all because mostly the reason is because of the folic acid deficiency. So in that pregnancies, we can offer them 5 milligrams of folic acid instead of 400 micrograms of folic acid. Okay. Because why you need to supplement is because the folic acid, the natural food sources of folate are poorly absorbed, and also when we are cooking them, most of the folic acid will get destroyed. So always supplementation is important in case of folic acid. Yeah, role of vitamin B12 is because that is also required for development of the red blood cells. Otherwise, when the cells B12 deficiency is there, what happens is the cell size is very large. We call it as a megaloblastic anemia, because when you see the blood picture under a microscope, definitely you can identify what type of anemia is there. So B12 supplements also has to be given. And we also, one thing we have to rule out is, because B12 deficiency can also happen when the patient is not having the absorption in the stomach. This is called as pernicious anemia. When there is no absorption of B12, we call it as a pernicious anemia. And you have to rule out this also. And vitamin B12 is only mostly available in either only animal sources. Animal food is a much better gives better supply of vitamin B12 rather than plant sources. So vitamin B12, you can suggest them like all the animal non-vegetarian sources of food can be given for this vitamin B12. And vitamin B12 injections are also available if the vitamin B12 levels are very less. And so two things you have to take into consideration: folic acid and vitamin B12 also must be considered when you're treating this new nutritional anemia. Next slide, please. All the green leafy vegetables again are rich sources of vitamin B12. You can, sorry, vitamin B12 is mostly from animal sources. So you can ask them to take animal rich like meats and poultries can be recommended for them. And food sources of folate include all the leafy green, dark green vegetables, dried beans and peas, citrus fruits, and most of the berries, and fortified breakfast cereals are the richest source of folate. Next slide, please. So prevention is always better than cure. So spreading awareness is important. Um, so improving iron stores and correcting anemia prior to pregnancy helps to decrease maternal morbidity and mortality. So what is the main reason for this maternal morbidity and mortality? Mortality in the sense death of the patient, and morbidity means because they may have severe effects on the, even the patient is uh, even the patient is okay, has been survived out of this catastrophe, still they have a lot of complication which may happen in a later stage because of the postpartum hemorrhage, like excessive bleeding after delivery, or having a growth retarded baby. All this can have a lot of impact on the families as well as the patient itself. So it's very important that spreading awareness is very important in the patients. Because sometimes what happens, after delivery, because of the lack of the most of the anemic patients, what happens, they'll start to bleeding heavily. So we can't do anything because no one will be ready to, because they may have a very rare blood group, you may not have the donor available. And when you're having such degree of bleeding, all the resources must be there. But mostly in peripheral places, they may not have all the resources to help the patient. So in order to avoid all these complications, we need to educate the patients. So spreading awareness is very, very important in these cases so that you can have a better mother as well as a good pregnancy levels of hemoglobin and a joyful pregnancy, which ends up to be very fruitful for them. Next slide, please. Okay. So any doubts, anyone? Yeah, caffeine you can take, but usually what we suggest is it has to be avoided just before taking any iron-rich food or supplements because it interferes with the absorption of iron. Yeah, B12 is yeah, dragon fruits and grapefruits. It's also a very rich source of B12. Yeah, not only high intake of iron can cause constipation. Normal, a few people are like prone to constipation when they take iron supplements. So depends. Individual variation can be there from patient to patient. Some patients may not have constipation at all. So depends on the patient's intake and how the patient can cope up with the iron supplements. It's definitely if you have, there are few options like you can take medications which are also having some laxative effects. How much? Yeah, watercress seeds can be taken in pregnancy. Can iron and calcium supplements? Iron, I cannot get your. Can iron and calcium supplements? No, iron and calcium cannot be taken together because calcium, what it does is it interferes with the absorption of iron because it forms some combination. It combines with iron supplements, and this complex compounds will form, which decreases the absorption of iron. So they cannot be taken together. How much interval should be between iron and calcium? At least 1 to 2 hours because calcium will take some time for absorption, and then once it is completed, then you can give some gap and you can take iron supplements as well. Elderly says to avoid grapes because nothing to do with grapes and pregnancy. Grapes can be taken. They have this elderly people, what they say is they say when you take grapes, black grapes especially, the baby will be in that black color. So that is the only reason they say to avoid grapes. Otherwise, grapes has nothing to do with pregnancy. Probiotics, why do you want to give probiotic supplements? What is the rationale behind probiotic supplements? Because probiotics, you can usually ask them to take lots of curd, and that will all help them. If in case probiotics are not, they can take. There is no contraindication to take probiotics in pregnancy. In fact, probiotics has a particular role, like in preterm deliveries or something. You can ask them to take recurrent pregnancy loss. There is a new. This is a new thing like probiotics can be given in pregnancy to prevent some preterm labors and recurrent abortions. In such patients, we can give probiotics, but still the thing is going on. So definitely, I don't ask them to take say that probiotics can be given in pregnancy. Yes, even with the patient with good stores of iron, they cannot be taken together. Yeah, anything, whatever the twins is, whether it is a monochorionic diamniotic twins or diamniotic dichorionic twins, anything is twins itself causes excessive load on the mother. So definitely the patient will be anemic. So the same regular things you can ask them to take, but you have to check them at definite intervals because usually what in twins is we have to do additional investigations like every 2 trimesters we can ask them what is their iron levels. They may be requiring additional supplements also. Instead of one, sometimes we may be giving them 2 iron tablets, or instead of iron sub tablets, if their hemoglobin levels are very less, you can ask them to go and take injectables. So depends on the patient's conditions. Whatever the twins, whether it is a monochorionic or dichorionic twins, the same thing. They may require hemoglobin iron supplements depending on the levels of hemoglobin they have. There is nothing like grapes reduce the milk production. There is no, yeah, there is nothing like that behind grapes. Grapes can be given in pregnancy. We never ask them to avoid taking grapes. Usually, most of the patients will be taking grapes. Uh, if it is in what amount of iron, usually what amount, usually 60 milligrams of iron is usually required in pregnancy, but the absorption levels depends. So some may be taking different levels of absorption each patient will be having. And what amount of iron will be suggested is depends on their hemoglobin again. Because if you do in the first trimester, you see that everything is fine, you can ask them to take just a single tablet, or you can ask them to have from meet with the dietary requirements. You can tell them all the diet advices you can give. But when coming to last trimester, because they're almost going to deliver, if they're still having low levels of hemoglobin, then you can ask them to take iron injectables instead of the dietary and supplements, because that will have a faster increase in hemoglobin levels. So depends on the trimester and depends on the hemoglobin levels also. At what stage you are seeing the patient is also important. Any other questions? Okay. No, for usually it is comes as a 60 milligrams 60 milligrams will be the minimum requirement of iron, but the absorption levels again varies depend on the type of iron you're giving, whether it's a ferrous form, ferric form, ferrous, because so many supplements have come into the market now, because you have what you can call as there are different varieties like ferrous ascorbate form, or biglycinate form, in which way you're supplementing the patient is also important for us. So it's 60 milligrams. Usually the requirement is between meals, in the sense like what meals, which meals, like afternoon or every two, because our body is having when like metabolism depends on the body's nature. Like if you're having a normal metabolism, every 2 hours you can take your but don't take the food at a time. You can give some at least 2 hours gap between two meals. Whatever you're taking, at least 2 hours gap is good. Yeah, you can maintain iron from fruit intake when your hemoglobin levels are good and you're entering your pregnancy with a very good hemoglobin levels. Usually, you can manage with dietary intake itself. Supplements are only required when you are not able to maintain your HB levels and we are not taking very good iron rich foods because see most of the people are from low socioeconomic status. Sometimes they cannot afford to take all the iron rich foods. Even though we suggest them, they don't give much importance to that dietary aspect. So that is the reason which we usually give supplements as well to compensate for this low intake of iron content, iron rich food. So definitely you can avoid iron supplements without giving any by giving a good dietary advice. But depends how the patient takes that because all of them will not be the same. Some will be very, you know, and they're very sincere and take all the dietary supplements, and sometimes the people will not take that good iron rich food. No, there is no connection with mother's dietary intake during pregnancy and the pigmentation in later period. That is nothing to do with all these things. Dietary intake and pigmentation. Pigmentation can be hypopigmentation, can be rather a genetic condition. So we have to evaluate the baby, like what can be the reason for this hypopigmentation. Whether there are any other associated problems there, we have to look into all these particular things. Nothing to do with dietary intake during pregnancy and hyperpigmentation. Yeah, is it better to take iron in the, yeah, that's what we usually suggest. But I suggest iron in the night and calcium in the afternoon because iron supplements for most of the patients will be complaining of this nausea and some irritating dyspepsia. So what usually because once before the bed they take, they may not notice all these things. So what I suggest is that is my personal experience to take the iron supplements in the night and calcium in the afternoon. Iron rich foods in babies, you can what you can do is when babies you can take all the pulses cereals, you can take them, and you can also give them mashed food like spinach, all the vegetables. You can just boil them and mash them and give it to the babies. After 6 months, when the baby is in a stage to take this foods, you can mash them and give them to the baby. All the green leafy vegetables, carrots, you can mix them everything. You can mash them, grind them, and then give the baby. No, usually iron supplements are not taken on an empty stomach because they'll cause more of nausea and this vomiting sensation they can take if you're taking them on an empty stomach. Yeah, babies are born with iron stored because depends on the maternal condition. If the maternal condition is very good, babies also can have this good iron stores. Hypopigmentation is your personal experience. Oh my kid is having. Yeah, but the 1 year kid having a vitamin D deficiency and iron deficiency, maybe because of any other conditions also you have to evaluate. Because usually whatever iron or whatever calcium you're taking, the first thing what happens is baby takes whatever the baby requires will go to the baby first. And then if anything is remaining only the mother will have. So usually this vitamin deficiencies and the iron deficiencies may not be seen in the early stages of the childhood. But if you're seeing very early in the childhood, maybe you can evaluate the baby if they're having any other problems also. It's very important. Which fruits or vegetables are avoided during pregnancy? Usually, all the fruits and vegetables can be taken during pregnancy. There is nothing to avoid, but only few people are concerned of taking this pineapple and papaya during pregnancy because they have usually what they think is this papaya will stimulate the uterine contractions, but that happens only with the raw thing, not the ripe one. Okay. Uh, in the normal case, what is the daily requirement from day? It is usually 60 milligrams is the preparations which usually most of the preparations contains only the 60 milligrams because only 10% of this will get absorbed. Not the whole thing will not be getting absorbed in pregnancy. Is it not compulsory to give vitamin D and iron drops to baby? No, iron drops usually most of the pediatricians will not be giving iron drops to babies because it's only the multivitamins they give. Generally, it's only that thing. And the newer thing is the vitamin D levels, because most of us are deficient in vitamin D levels, and that's what vitamin D is related to so many things in the babies also. So vitamin D and there will not be much exposure to the sun also in the babies. So vitamin D drops can be given, and most of the babies they will not be given the iron drops, but instead of that they're giving multivitamin drops will be given. Yeah, the reason for vitamin D deficiency is so early childhood can be also, you can just consult a endocrinologist also, because whether the hormones which maintain the levels of vitamin D are working properly or not, or are there any particular reasons for this vitamin D deficiency? If in case it's only a vitamin D deficiency because of the dietary reasons, anyways, it will recover after giving this vitamin D drops. That may not be a problem. But if the baby is not recovering from vitamin D deficiency, even after proper supplementation of all these things, maybe then you have to evaluate what can be the reason for this vitamin deficiency. Because kids, they will not be evaluating as early as as they do for the adults. So you can evaluate the baby if vitamin D levels are not picking up even after supplementation. Daily amount of iron in non-pregnant women or men. I couldn't get this. Daily amount usually 10 to 12 milligrams is what we usually 1 milligram will daily losses will be there in non-pregnant state, and there will be 2 milligrams of iron loss in the menstruating stage. And whatever diet we are taking, it is usually contains an average Indian mixed diet contains 10 to 12 milligrams of iron, and that in that only 10% is getting absorbed. Yeah, this is the 60 milligrams iron supplements. That's what I'm telling on the basis of in pregnancy. Like for normal basis, I think I have to check this. In pregnancy, definitely it's 60 milligrams. Most of the supplements contains that. And in normal pregnancy also, I need to check this, like exactly what's the amount, I don't have idea. Normal patients. Oh, this is men 19 and women 29 milligrams per dose. Okay, thank you for giving me this information. Anything else? So can we end the session now, Anishma?
Yes, ma'am. It is over. We can end the session.
Okay.
Thanks a lot,
Okay.
ma'am.
Thank you. Thank you.